Welcome back to Live at 9. It's Wellness Wednesday, and it's also that time of the year again, pollen season. And here to help us fight our runny nose, our sore throats, and watery eyes is Dr. Quinn. Good morning, Dr. Quinn.
Good morning.
So what do you usually see when people come in this time of the year with lots of pollen allergies?
Well, like you said, runny nose, itchy throat, watery eyes, and just feeling miserable. Sometimes people say they have a headache so bad it's killing them. They feel tired, they feel disoriented, dizzy. I mean, I hear it all. But the first thing we do is we make sure they don't have the flu, because a lot of these symptoms could be the flu or COVID or even strep throat. So we test the people first to make sure that we're treating the right thing.
Absolutely. And overall, I mean, why does this happen? We know, it's spring season and the pollen is increasing, but why are we seeing these effects for everyone dealing with pollen allergies?
Well, we can't say everyone. We can say probably 85 to 100% of the population have pollen allergies, meaning that our immune systems are irritated when we come into contact with the pollen, making all those symptoms occur. It's like the immune system is fighting and it is causing us to have all those symptoms, but it's really a protection modality that we inherited so that we can be safer.
That's really interesting, Dr. Quinn, that you say that as well, because I never thought of it like that we actually might need this. But how do people fight off those symptoms of pollen that we have to deal with, or a lot of people have to deal with this time of the year?
Well, there are a lot of things you can do. Like, there's not a lot of doctors going to say just go to the pharmacy. But if you go to the pharmacy, it's probably not a bad idea to take a self-home flu COVID test to make sure you're not treating the wrong thing. As I said, as we evaluate the patients when they come to our clinic.
Right.
But also you can buy over-the-counter antihistamines. I talked to a pharmacist this morning and confirmed that you can get like Sudafed over the counter, but you have to show your driver's license. And it's a little bit limited on how much you can get, because the state of Mississippi, as well as a lot of states across the country, don't want people to just get too much Sudafed and make methamphetamine, which can be very dangerous. But also you can get the nasal steroid spray, which is very good. The Flonase is over the counter now. And but if that doesn't work, then it's probably best to go ahead and see your medical doctor. And what we do is we'll give you like a steroid shot if it's really bad, or we can give you oral steroids where you take the pills, and we can give you Sudafed at a higher dose. And sometimes we'll give a prophylactic antibiotic just in case.
Gotcha, Dr. Quinn. So there really are a lot of ways to make these symptoms a little bit more bearable and easier to deal with as well. So you can start with those over-the-counter antihistamines and stuff that you mentioned, but also if it gets bad enough and it is severe enough, you can visit your provider and talk to them. And again, make sure you're not dealing with something more than just allergies. But what if someone is severely allergic? What can they do then?
Well, I'll tell you what I did a few years ago, and I think I'm still benefiting from it today. That was over 10 years ago. So my doctor just got tired of looking at me. So he referred me to an allergist, and they did skin sensitivity testing where they introduced the different allergens underneath my skin. I was allergic to everything.
Wow.
Pollen, ragweed, grass, bark. So they started injecting these antigens into my bloodstream once a week. And see, what happened was my autoimmune system became desensitized, where if I came into contact with the pollen, I had less symptoms. But I think I might go back, because I think it's starting to wear off now. But this is called allergy testing. And this is something that you can discuss with your doctor if he wants to refer you to an allergist, or I think ear, nose, and throat doctors do it as well. But this is a good option. Another option, when you get in the house, if you've been outside, take your shoes off, maybe take your clothes off, put them in a plastic bag in the dirty clothes basket, and then take a shower immediately and wash your hair. And try not to like leave the windows open, maybe keep them closed, use your air conditioner when it gets hot again, which it will in the next couple of days, try to keep the pollen out of your home. And like me personally, I like to go outside and run, but during this season, I do the bike more, or I'll go to the indoor pool at St. Dominic's and do laps for my exercise. You probably want to try to stay indoors more than normal during the worst times of the pollen season if you're somebody like me that has severe allergies.
That's